Medical professionals of Reddit, what's the funniest thing a patient has said under anesthesia? Yelling for his brother then whispering loudly to him, check to see if I still have my D. I think they took my D then proceeded to flash the whole room. Edit. For those asking, the procedure was to remove a benign tumor in his cheek. Face cheek, not butt cheek. Was recovering a patient after surgery who got ketamine, which has a known side effect of making you super emotional. When she woke up she started catcalling me, telling me how attractive I was. Then she got worked up because she was thirsty, so I told her I could get her ice chips. As I am getting her ice chips she starts to go, I hate to see you leave but I love to see you go. As I disappear to get her some ice chips she starts crying real tears that she scared me off and how sorry she was. I apparently can't handle my anesthesia. The first time I woke up I asked the nurse if I was going to be able to fight by Monday. My wife properly translated that to can he teach his wrestling class. Before we went home, she wanted to drop off my prescriptions at CVS. She left me locked in the running car. After she dropped off the prescription, she turned around to find me in the CVS standing in the frozen dairy section holding German chocolate ice cream. I told her I needed it because my people made it. Car was still running with the passenger door left open. 18-year-old girl recognized the male anesthesiologist from Tinder last week and accused him multiple times of not showing up to their agreed date, while randomly falling half asleep in between. As we put her back in bed she mumbled that she is not even mad, just generally disappointed in men and that she still thinks he's pretty. In the early days of my surgical training, there was a day that I was assigned to a colonoscopy list. Standard practice is to pre-medicate patients in the anesthetic bay if required, particularly if they are a bit anxious about the procedure. I was clerking one of the patients in the anesthetic bay, going through consent and the usual pre-op routine when I noticed that she was giving me these weird sidelong glances and that her eyes would dart away every time I tried to make eye contact with her. She was also extremely fidgety and was stammering a lot in her responses to my questions. I kind of shrugged it off as pre-operative nervousness and let the anesthetist do his business. Fast forward 10 minutes and I'm standing behind her, she, curled up into the fetal position with her A hanging out and I, colonoscope in hand. As the propofol starts rushing through her veins, she turns right around, grips my forearm and stares up at me with a dreamy look on her face and goes, "You know what, doc? I bet you kill it with the ladies." A moment later she was asleep and I was checking her colon for polyps. I just had a bowel resection and was hopped up on morphine. My divorced parents hadn't sat in a room that long together in forever. My sister, uncomfortably quiet between them, tells me my junk is hanging out of my hospital gown and I say, if my balls are hanging out, that makes this a ball gown. Really helped with the tension. Anesthesiologist here. During recovery from general anesthesia, I called one of my patients by his full name in a loud voice. He opened his eyes, suddenly jumped upright and sit on the bed and he said something. "Sir." "Yes sir." He was under military service at that time. Not a doctor, but I was told by my dentist that when he was prepping me to remove my wisdom teeth, I asked him why he became a dentist. I vaguely remember him telling me a story about how when he was a preteen he was at a local pool, running around when he slipped and smashed his chin on concrete and shattered some of his teeth. Ouch. He was amazed at how well they reconstructed his teeth that he decided to go into dentistry. Apparently, I then looked this man in the eyes and said, "Well, that's a stupid frickin' reason to become a dentist. Sorry, Dr. J." Had a patient come into recovery after surgery. She farted so long and loud the entire 20-bed unit heard her. Then she said I was trying to clear my throat, excuse me, and I want a vanilla latte. I got a headache. As medical professionals, we had to hold in the laughter, but that didn't stop patients from turning into hyenas. I'm preparing to salsa dance. I'm a doctor and was getting a knee reconstruction and asked one of my best friend's dad to do my anesthetic. He was head of department at the hospital I worked at the time. Apparently after he gave me the midazolam to chill time out and basically I forget everything from then on, he inserted a local anesthetic block into my leg. The next day he told me what happened. Apparently, I then told him it's not working and he should have done it higher up and I tried to grab the needle from him to show him, after I asked if he knew what he was doing. I also complained the bed was cold. We still have a good laugh about it. Woman woke up from surgery and said to her husband, David, that alarm clock has a nose and it's running. Wipe it. Right double quotation mark. 65-year-old woman who had a wrist surgery. She was anxious so they gave her a good whack of propofol, the milk of amnesia. Mid-surgery she was having the time of her life. In a thick Northern Irish accent she was like, did you just fill me up to me head with vodka? Gimme a wee bit more boy, I'm loving this. Then she said the anesthetist looked like Freddie Mercury and started singing Don't Stop Me Now. The anesthetist looked nothing like Freddie. The very first time I was under I was in 3rd grade and was relatively scared. What kept me brave was the promise of Burger King breakfast afterwards. It was an early morning procedure that required fasting and I rarely got fast food. They ended up running behind that day so it was up in the air if I would wake up and get out in time to get my breakfast, which ended at 10. The first words out of my mouth were, what time is it? When my mom informed me it was already about 9:30 I tried to get out of bed and nearly ripped out my IV in the process. When she tried to tell me that we would be late and I could get it another day I promptly burst into tears. Edit. I did get my Burger King a different day. Thank you all for your concern. Level 3 Ninja. One of the times I had an endoscopy when I was around 10 years old I woke up pretty groggy and naturally with a dry and sore throat. I asked the nurse for water but she said I couldn't have any yet. She left the room so I started climbing over the raised sides of the bed to get some. She walks back in with me almost at the point of no return, also the point immediately preceding the point of face planting the floor as I was in no state to be balancing or climbing, freaks out screaming, what are you doing? So I say something along the lines of getting some water and she relents and goes and gets me some. Young girl after a root canal said, where are my dentures? When I was a toddler, my mom fell off our roof and broke her back. Apparently she was terrified she was going to become a vegetable, because after her back surgery she asked the nurse, am I a broccoli or a cauliflower? Apostrophe. Not a medical professional, but my mom was coming out from under anesthesia after a procedure a few years ago and I was trying to help her. She puckered her lips so I picked up a water cup and asked if she wanted some. She turned her face toward me and said, do I look like an airplane? The nurses and I completely lost it. I still tease her about it sometimes. I'm a consultant anesthetist, UK, and there are loads. Often declarations of love from the patient as the drugs are kicking in. My all-time favorite is a 40-something guy a few years ago. He needed a testicle removing for cancer. He never had an anesthetic before and was super nervous, to the point of barely saying anything to anyone. As the drugs started to kick in, we realized someone was quietly singing. It was the patient. Hitler has only got one ball. Apostrophe. I gave a kid methoxyflurane after he broke his arm. When we got to the hospital he went into the pediatric section of the ED and there were stickers on the wall of Sesame Street characters. He started talking about this unicorn on the wall, there wasn't one, and how it was trying to be friends with Elmo but Elmo didn't want to be friends with him. His mum and I had a chuckle and I had to pry the whistle out of his hands. Dislocated my shoulder in a way that my arm ended up stuck up over my head. Apparently, while all hopped up on Demerol I was laughing hysterically while the doctor was standing on the table gurney wrestling with my arm to get it back into the socket. I don't remember a thing. I had double jaw surgery to correct my underbite. I took sign language in college. They typically don't wire your jaw shut anymore, they just use strong rubber bands, but you can still talk. I knew I'd be able to talk. Yet when I woke up from the surgery, apparently I kept trying to sign. The nurses were like, "UHH, we don't know sign language, honey." Based on how little I remember from college, I'm certain it wasn't even good sign language. AskReddit, to those of you who are getting this surgery, or are thinking about getting it, make sure you pick a good surgeon. Mine was Dr. Reed Day in Phoenix, Arizona. He's one of the top maxillofacial surgeons in the country. He was the guy who put NHL hockey player Jeremy Roenick's jaw back together after he broke it in multiple places. He did a perfect job and my swelling didn't get too bad or last that long. I looked back to normal in a matter of weeks. I got it for cosmetic reasons. I'm a female and I hated my underbite side profile. I wanted it for a long time, but didn't have the money to do it until I was in my 30s. The only regret I have is not getting it done sooner. I do have some permanent numbness in my chin and bottom lip, but it doesn't bother me at all. If I had the surgery when I was younger, those nerves probably would have had a better chance of healing, so that's why I wish I hadn't put it off for so long. But mostly because it gave me the self-confidence I was lacking in my 20s. I love my face now and it's nice to hear dentists tell me I have a perfect bite. This woman undergoing C-section under spinal anesthesia plus ketamine said show my baby first to my brother-in-law. He deserves to see her first. I sometimes wonder what happened to her marriage after that. Am I in hell? Right double quotation mark. Anesthesiologist told me that as I was going down that I was describing my fingers feeling like French fries, but French fries after you take them home and put them in a microwave so they're soggy and not as good. I sat straight up in the bed, they tell me, and shouted I didn't ask for this. Then I turned to a nurse and pleaded, "Okay, mom?" Apostrophe. That I look like a guy who worked for Bon Jovi. Patient came into the ED as a trauma, got ketamine sedation for an emergency procedure. I'm the no, you're okay, we're taking care of you, I'm a ghost. Who? Wavy arm motions okay. The most memorable funny one was a guy who sat bolt upright, mime rolling a cigarette and tuck it behind his ear saving it for Ron when I asked what he was doing. Anesthesia can be a wild trip. The kids will always scream when they wake up. Not anesthesia but delirium. Introduced the oncoming nurse to the patient. The patient gestured grandly around the room and said, "Nurse's name, meet all my friends." Dot. To an empty room. My brother had top surgery and woke up from being put under. My stepmom, whom I call mom, recorded him talking about how Abe Lincoln was a great guy. She asked him how he knew and he replied with, "I knew him back in Nam." And that's the story of how my brother fought side by side with Abe Lincoln back in Vietnam. A woman was absolutely distraught that she was going to be made to eat asparagus and was repeatedly telling us that she did not like asparagus, especially with eggs, and was politely rejecting the asparagus she thought we were constantly offering her. My dad, Italian, was waking up from anesthesia and kept looking at his Asian nurse and saying he was so glad his daughter was with him. And that he loved his daughter. The nurses were confused, so they went out into the waiting to check for his daughter. I was the only one in the waiting area, and when they saw me and started hysterically laughing. I am Korean by birth, but was adopted by my lovely Italian family. I was the patient, but right before Christmas a couple of years ago I had my gallbladder removed. In the recovery room as I was waking up, I became obsessed with singing the 12 Days of Christmas song. I kept asking the nurses what order the verses were in. As they were wheeling me out of the room, I heard a nurse belt out 5 golden rings, which was followed by everyone's laughter. A girl I worked with told the story of how she got grounded from age 15-18 because of anesthesia. She was having a colonoscopy, and as she was a minor, her mother was in the room with her. After she was sedated, and as the technician started to insert the scope, she mumbled, "No, not again. Boyfriend's name. It hurt last time." Her mother was not amused. I was the patient. After coming out of surgery for a hernia at the age of about 15-16, my father helped me to the bathroom in the hospital. I was pretty freaked up still and said, "Boy dad, I was just so worried I was going to get an erection during the procedure." He laughed and made a slicing motion with his hand, implying the doctor would have cut my D off, and I burst into tears and threw up on myself. Edit. First time receiving awards, I'll be sure to pass them on to my dad. Vet tech here. Dogs and cats come out of anesthesia in an assortment of different ways. But this one husky, I swear, lifted his head and said, "Thank you," in that strange way that some dogs can actually sound human in their bark voice. The other tech and I just looked at each other and said, "Holy s, did he literally just say that?" Not medic but patient. I had appendix surgery after a preventive 2-day fasting. Water was okay, and anesthesia hit me pretty hard. When I was told I had to use one of those plastic urinals or whatever because they said the abdominal effort could make me faint, I just said, "I ain't gonna poop on a plastic tupper. If I pass out in the toilet like a hero, then let it be." But when my sister got her wisdom teeth out, she screamed in the car until we stopped and let her out, near our house, and she sprinted back to the house because she wanted to race the car. I need to go find that video. Wife got an epidural right before childbirth and said some funny things. Once the baby's head was in the birth canal, the nurses asked if she wanted to touch a baby, and she said that nobody is allowed to have sex with her daughter. After being put under to have a wisdom tooth extracted, I told everyone for an hour that my balls were tingling. I mean, they were. And folks just needed to know because it was hilarious. At least, to me it was so funny. We had to stop by the grocery store on the way home, and I think a few dozen people there heard about it. My poor wife. I always start to compliment everyone I see after waking up from anesthesia. It's super important to me to compliment them, it seems. You nurses are doing such a good job. I hope you know that. Such a great job. Whoa, you're all so beautiful. Why is everyone so beautiful? Thank you for taking care of me. That's really nice of you. I love your eyes, they look kind and pretty. I am not fully there yet, but I still always react the same. I am scared and worried that they don't know how great they are. I have no filter when I wake up. Normally I am too shy to say everything I think about others. And a few minutes later I start to throw up. Every single time. Not a doctor, but my grandma was still loopy from surgery when they brought her lunch, including a roll with a little pat of butter. She looked at grandpa and said, "I hope they don't expect me to eat all that butter." Right, double quotation mark. We were having a very intense conversation during the patient's procedure about fire pits, pros, cons, likes, dislikes, lucks, budget, just went on. Patient wakes up and says she was dreaming about fire pits. We sedated this elder white lady to reduce a shoulder dislocation. I don't remember what it was, but the doctor said a couple words in Spanish, with the most gringo pronunciation imaginable. This woman was almost completely out, but her eyes shot open and she sharply corrected the doctor's pronunciation before passing the frick out. We were all trying so hard to keep it together while we were working on her shoulder. I did have one patient that wasn't under anesthesia, but was a bit confused. This poor lady had some absolutely rancid fecal squirts all over her bed. It was everywhere. I went in, doing my best to not succumb to the acrid burning in my nose and make her feel okay about it. But she sees the poop in her bed and her eyes go huge. Then she says, "I knew that man pooped in my bed." I asked her what she meant and she said there was a man here earlier, and he pooped in my bed. I know it was him because I would never have done this. So I gently told her, "No, I'm the only man that's been in your room." So of course the conclusion she came to was not exactly what I expected from that. She then gets upset and asks, "Well then why did you poop in my bed?" I was really trying hard to calm her paranoia that there was someone coming in just to take a S in her bed, under her blankets. But apparently I sent the wrong message. I was trying so hard not to laugh my A off. I actually had to step out for a minute because I couldn't keep it together. Not me, but my boyfriend. He went under anesthesia because he had 4 fricked up teeth. He is an anxious patient when it comes to dentists, so I was allowed to be with him in the room till he was finally under. His last words before the anesthesia were, "I don't want to die," and luckily he didn't. It warmed my heart though, because he had 2 suicide attempts before I've known him, and I am glad he changed his mind on that. After the anesthesia he was just groggy, but on the way home in the car he saw everything double and always screamed at me, because he thought I would crash into another car. Edit. Thank you all for the crazy upvotes and my first 2 Reddit awards ever. You all are just so nice. Every time I wake up from anesthesia I ask the nurses for food. Then I complain that they are not allowed to feed me in recovery and that I was a good girl and didn't eat before surgery. There is usually a meal waiting for me by the time I get back to my room. Every time it feels like the best meal I've ever had. I had gotten 4 wisdom teeth out in July, and I was under anesthesia for an hour. When I was done, I woke up in a chair and asked the nurse where I was. She said I was at the dentist and I said, "Still? Jesus Christ." And she thought that was funny. On the drive home, there was a turtle in the road. My mom stopped to let him pass and I got out and tried to catch him. I have a video of me laughing at the turtle. Edit. Yes, I am going to be one of those people. Holy s 2000 upvotes. Thank you for finding humor in my wisdom tooth pain. I also threw up on the living room floor because of the meds they gave me. Edit 2. No, I'm not going to show the video. It has my face in it and I would prefer not to. Sorry, you're level 3 ninjas, so why don't the rest of us have a video of you laughing at the turtle? Oh god, I woke up sobbing. I was convinced that I was married to Cedric Diggory and he had just been killed by Voldemort. I'm cringing so hard just thinking about it. I was inconsolable. I had my wisdom teeth out, and when the nurse woke me up in recovery, I started laughing hysterically. I kept apologizing and laughing, so much that blood was dripping from my mouth and it scared my wife when she first saw me. I remember calming down a little, and a girl next to me was crying as she was groggy from her anesthesia. I started laughing again as she was crying, not sure why. And then a guy who had a colonoscopy came into recovery, and I remember seeing him laying on his side. Presumably so the gases can escape. Well, he started to let his gases pass and they made a bellowing sound like a belching banshee. I again started laughing so hard my mouth began bleeding again. OHH, and on the way home from the hospital, my wife drove, and I would shoot the traffic lights with my fingers. Pew. Good times. When my brother was waking up after a surgery, my mother was there taking care of him, but he couldn't stop laughing. When he was finally able to squeeze out a few words he said, "Mom, ha ha ha, Mom, you're so ugly." Apostrophe. Not a professional, but I was the patient about 20 years ago when I woke up in my room. My nurse was laughing, so I asked what was up. She She said I'd told everyone in the recovery room a joke, so I asked what it was, but all she said was something about George Michael and Wellington boots. It took me a second or two to sink in through the grog of anesthesia, but this is a joke I told to a whole bunch of people I'd never met before. What has George Michael and a pair of Wellington boots got in common? They both get sucked off in bogs. Bog is UK slang for toilet. I then burst out crying for no apparent reason. Go me. I walked past an ER room. The patient inside saw me and called out, "Dude. You are, like, a burning eagle right now." I said, "Cool, man," and then his RN told me he was high on acid. Nad but. I kept asking about puppies that I swear I heard barking. I just wanted to see the puppies and know why the puppies were there. I was so upset that no one else had heard puppies barking. Obligatory, not a doctor, but I was the patient. I had to get my wisdom teeth removed at the hospital because they were, for lack of a better term, fricked. When I woke up, the nurse was going through the routine to make sure I was not brain dead. She asks me my name by saying, "Who are you?" I respond with, "I'm a lesbian." My parents were in the room. They didn't know at the time. That was how I came out. Wasn't said directly to us, but his wife relayed the message. Her husband thought that he was abducted by aliens and was anal probed. He came in altered and couldn't follow instructions, altered due to wicked high ammonia. To bring down his ammonia we had to give him lactulose PR. So we gowned up with face masks, face shields, and white paper gowns, 2 each in fact just in case. Both of us administering our 6 feet 3 inches. So he recounted to his wife the next day about how he was in a bed on his side and 2 tall, white aliens with plastic faces he couldn't really see were probing him. Admittedly this isn't under anesthesia, but it is a story of when a PT was altered and we died laughing, as did the wife, when we were told. Enjoy. The reason his ammonia levels were so high is BC he had liver issues and it was well known, documented. He was on meds to try to control it, but his liver was failing so he had a spike of ammonia levels which caused the AMS. He was unable to follow directions to take oral meds BC he was altered, and also the best absorption for the lactulose med to get the ammonia down as quick as possible is in the backside. My husband was given ketamine as a sedative for a surgery he was having, but tissued, meaning the drug was in his body but being slowly absorbed by the tissues rather than direct into the bloodstream. The medics tried again, it happens again. By the 4th attempt it works. He has really sty veins, cause renal failure will do that. He has his surgery, but in the meantime the rest of the doses are working their way into his system. The surgery finishes, and he's wheeled back into the ambulatory care ward where I am waiting. He sees me and waves yelling, "Beckett, Beckett, guess what? I'm on special K. Dot." The ward grinds to a halt for a second, and the staff are trying desperately not to start laughing. I just nodded and said, "Yeah, you are, aren't you?" Bonus points for the gentleman 2 beds over who I overheard asking his anesthesiologist if he could have what my husband had, please. He was so high, and the staff came and explained why and apologized to me. It was all good though, it did him no harm. Had a dementia patient tell me her favorite food was mouse. I was very torn between laughing and crying. Had surgery a few months ago, and as I was coming out of the post-op, I was hearing these weird mewling noises. After several minutes of half delirious napping, I asked the nurse if someone wouldn't please feed that cat already. Turns out, it was a woman who just had a baby by C-section. The mewling was the baby crying. The mother wasn't impressed. TLDR. Grandma thinks she's Jesus Christ reborn and I try to sing Christmas carols. Grandma, a few years ago, she broke her wrist and had to have surgery to get a metal plate put in. In the operating room, she was on the table and her arm, with the broken wrist in question, was strapped to an arm extension, so she looked like she was put on the cross with one arm. She had been given anesthesia, she was still conscious, and a nurse was standing next to her. "How you feeling, Jan?" the nurse asked. With a monotone voice, my grandma looked the nurse in the eye and said, "I am Jesus Christ." Me, I had to get a few cavities filled last year after school. After checking in and getting in the chair, they administered a lidocaine, dental anesthesia, and nitrous oxide, laughing gas. I should mention that this happened a couple months after December. During the operation, I took a deep breath through my nose and the gas mixed with the anesthesia really hit me. I felt like I was floating in space. What do you do when you're floating in space? Sing Christmas carols, of course. The dentist and the assistant, having filled 2 cavities at this point, were double checking the x-rays before starting the 3rd filling. I started trying to sing Jingle Bells while they got started on that filling. My face was too numb to actually make any sounds audible. For the rest of the other fillings, I tried to impress the world with my singing. Thank you for watching. Don't forget to like, subscribe and leave a comment.